There's a question as to what is a safe level of alcohol to drink. If you look at these three containers, on the biggest container is for beer, and the level of a standard drink is a little less than that container, 12 ounces of beer a day. The second container looks like it's for wine, and the safe level of alcohol of wine to drink is 4.5 ounces. And then on the far side, there's a container that holds liquor, and you can have 1.5 ounces. Now, for a man, it's supposedly a safe level is 2 of these drinks a day. They call them standard drinks. And for a woman, it's 1 standard drink a day. We're going to read a paper that will challenge this position. Today we're going to discuss the paper that was published in the Lancet in 2018. The title of the paper is Alcohol Use and Burden for 195 Countries and Territories, 1990 to 2016. A Systematic Analysis for the Global Burden of Disease Study, 2016. Now, in simpler language, this is a study looking at the use of alcohol over 26 years in 195 countries. They analyzed many different factors. Now, if you look down, it says GBD, Global Burden of Disease, 2016 Alcohol Collaborators. In this paper, at the end of the paper, are listed the authors. There are a tremendous amount of authors of this paper. There's probably at least 500 authors, maybe up to 1,000. On the bottom, you can see where this article was published. It was published in the Lancet, 2018, and volume 392, and you see the pages. It was published online, and you have the date there. And then it has an address there to get this paper. It's a very easy paper to obtain, and we will have it available to the reader. In the paper, there are several different parts. We're going to go down to the finding parts. This is in the beginning of the paper. This is also used to be called the abstract, and it's still called the abstract in many scientific papers. This points out the findings from this paper. Globally, alcohol use was the 7th leading risk factor for both deaths and disability in 2016, accounting for 2.2% of female deaths and 6.8% male deaths. Among the population aged 15 to 49, an important demographic, alcohol use was the leading risk factor globally in 2016, with 3.8% of female deaths and 12.2% of male deaths attributable to alcohol use. The next paragraph, or sentence, is very shocking to me. It states that for populations aged 50 years and older, cancers accounted for a large proportion of total alcohol deaths in 2016, constituting 27.1% of total female deaths and 18.9% of male deaths. They note that their conclusion from their whole entire study is that the level of alcohol consumption that minimized harm across health outcomes was 0 standard drinks per week. So alcohol is involved in a lot of death and disability, and the only real safe level of alcohol to drink is 0 drinks per week. The interpretation of the entire study is going to sound a little repetitive, but the interpretation from the entire paper is that alcohol use is a leading risk factor for global disease burden and causes substantial health loss. We found that the risk of all-cause mortality and of cancers specifically rises with increasing levels of consumption, and that the level of consumption that minimizes health loss is 0. It's amazing to me, and I didn't know this prior to my studying this, is that alcohol is a carcinogen. And a lot of the deaths attributable to alcohol on a chronic basis is from cancer. Now, it does state in here that the amount of problems with alcohol increases with higher usage, but the only usage that's associated with optimal health is 0 drinks of alcohol a day. This is the introduction to the paper, and I'm only going to read certain portions of the paper. One of the things that I want to do is teach the reader how to read a scientific paper. Now, it states that alcohol use has a complex association with health. Researchers have recognized alcohol use as a leading risk factor for disease burden, and studies link its consumption to 60 acute and chronic diseases. Now, at the end of that sentence, you see numbers 1, 2, 3. So that is references that substantiate those sentences. The next sentence states, additionally, some research suggests that low levels of alcohol consumption can have a protective effect on ischemic heart disease, diabetes, and several other outcomes. They note the references to those papers that say that low levels of alcohol may help certain diseases. And then they point out that this finding remains an open question, and recent studies have challenged this view by use of Mendelian randomization and meta-analysis, and they have the references for that. In other words, the suggestions that alcohol can help you have been refuted. The next paragraph reads, determination of alcohol harm to alcohol use is complicated further by the multiple mechanisms through which alcohol use affects health, through cumulative consumption leading to adverse effects on organs and tissues, by acute intoxication leading to injuries or poisoning, and by dependent drinking leading to impairments and potential self-harm or violence. Now we can see from that last paragraph that alcohol causes harm in 2 ways. It causes harm in a chronic fashion, and it also causes harm by acute intoxication. This paper takes into account both of those mechanisms. Now they state in the next paragraph, based on weighted relative risk curves for each health outcome associated with alcohol use, the level of consumption that minimizes health loss due to alcohol use is 0. Now, some of the listeners may be offended by these statements. However, these studies, you have to remember, were conducted over 26 years in 195 countries. The number of subjects that were included was 28 million participants, with 700,000 suffering adverse effects. So when they make these statements, they're not making them flippantly or because that's their opinion. This has been scientifically determined that the safe level of consumption is 0 drinks a day. We're going to go to the results of the paper. In the first section, they go over the global, regional, and national trends in alcohol consumption. They have maps that detail this for each country. They look at how much, what percentage of people in each country are drinking, and then they note how many drinks they're having. The country that has the most drinkers is Russia, and they also consume the most amount of alcohol. The countries that have the least are found in Northern Africa. Now, in 2016, 32.5% of people globally were current drinkers, 25% of females, and 39% of males. So you can see that the vast majority of people do not drink alcohol worldwide. These percentages correspond to 2.4 billion people globally who are drinkers, with 1.5 billion males and 0.9 billion females. Globally, the mean amount of alcohol consumed was less than a standard drink per day for females and a little over or close to 2 standard drinks daily for males. The prevalence of current drinking varied widely by location. Prevalence was higher for high SDI, that's socioeconomic. So countries that are richer drink more, where 72% of females, 53% of males were current drinkers. We found large differences between females and males in Nepal. This is a poorer country where only 1.5% of females drank in 2016 compared with 21% of males. For example, they also found minimal differences in Sweden. This is a more advanced or rich country where 86% of females and 87% of males were current drinkers. High SDI locations had the highest average of standard drinks consumed daily, with 1.9 standard drinks consumed daily among females and 2.9 among males. This level of consumption is above what's noted to be in the past a safe level of consumption, with females recommended that they drink less than 1 drink a day and males less than 2. Now that we looked at the what percentage of males and females were drinking and how much they're drinking, they're now going to give you the results for the global pattern in alcohol attributable deaths and disease burden disability. In 2016, 2.8 million deaths were attributable to alcohol use globally. This corresponds to 2.2% of deaths among females and 6.8% among males. Globally, alcohol use was ranked as the 7th leading risk factor for premature death and disability in 2016, compared with other risk factors in the global burden of disease studies. Among the population aged 15 to 49, alcohol use was the leading global risk factor for risk attributable disease burden, causing 8.9% of disability for men and 2.3% for women. Among the population 15 to 49 years, 3.8% of female deaths and 12.2% of male deaths were attributable to alcohol use. That's a high number. In that age population, over 10% of male deaths were directly attributable to alcohol use. To me, that's a very high number. The next paragraph is important for us people that are older than 50 years old. They looked at patients every 5 years, from 5 years old to 95 years old. But for the population aged 50 years and older, cancers accounted for a large proportion of total alcohol deaths in 2016, constituting 27% of alcohol female deaths and 18.9% of male deaths. That's from cancer. In high SDI countries, cancers were the predominant source of disease or attributable burden among both sexes. In low SDI countries, tuberculosis was the primary cause of burden for both sexes, followed by cirrhosis and other chronic liver diseases. In estimating the weighted relative risk curve, we found that consuming 0 standard drinks daily minimized the overall risk of all health loss. The risk rose monotonically with increasing amounts of daily drinking. So once again, the more you drank, the less problems that you had, with 0 being the best amount of alcohol to drink. You could see in higher economic countries, cancer becomes a major problem because I believe they're probably living longer. But in less well-advantaged countries, infectious disease and chronic diseases such as liver diseases becomes the predominant problem. The next paragraph talks about the potential protective effects of alcohol. Points out that past findings subsequently suggested a persistent protective effect for some low or moderate levels of alcohol consumption on all-cause mortality. However, these studies were limited by small sample size, inadequate control for confounders, and non-optimal choices of a reference category for calculating relative risk. So the old studies were flawed. However, more recent research, which has used methodologies such as Mendelian randomization, pooling cohort studies, and multivariate variable adjusted meta-analysis, increasingly shows either a non-significant or no protective effect of drinking on all-cause mortality or cardiovascular outcomes. There's a lot of debate over this, but recent research is using more powerful investigative tools that require very powerful computers and probably artificial intelligence. The next paragraph, taken together, these findings emphasize that alcohol use, regardless of amount, leads to health loss across populations. We found some protective effects for ischemic heart disease and diabetes among women. These effects were offset when overall health risks were considered, especially because of the strong association between alcohol consumption and the risk of cancer, injuries, and communicable diseases. These findings stress the importance of assessing how alcohol use affects population health across the lifespan. Our results point to a need to revise alcohol control policies and health programs, and to consider recommendations for abstention. In terms of reducing population-level alcohol use, the World Health Organization provides a set of best buys, policies that provide an individual years of healthy life at less than the cost of the average individual income. Governments should consider how these recommendations can be implemented within their local context and broader policy platforms, including excise taxes on alcohol, controlling the physical availability of alcohol and the hours of sale, and controlling alcohol advertising. Any of these policy actions would contribute to a reduction in population level consumption, an important step toward decreasing the health loss associated with alcohol use. Now, the individual should shoot for not drinking alcohol, but our governments can employ very simple steps to decrease the use of alcohol on a population-wide basis. They point out that failing to address harms from alcohol use, particularly at high levels of consumption, can have dire effects on population health. The mortality crisis in Russia is a striking example, where alcohol use was the primary culprit of increases in mortality starting in the 1980s and led to 75% of deaths among men aged 15 to 55 years. That's a startling statistic. Fourth, we were unable to find robust data about the harm caused to others from alcohol attributable interpersonal violence, a major potential source of health loss. This points out that alcohol harms not just the individual, but also the people around the drinking person, and also society as a whole is impacted in a negative way. The conclusion of this paper is as follows. Alcohol use is a leading risk factor for disease burden worldwide, accounting for nearly 10% of global deaths among populations aged 15 to 49, a very vital portion of our population, and poses dire ramifications for future population health in the absence of policy action today. The widely held view of the health benefits of alcohol needs to be revised, particularly as improved methods and analysis continue to show how much alcohol use contributes to global death and disability. Our results show that the safest level of drinking is none. This level is in conflict with most health guidelines, which espouse health benefits associated with consuming up to 2 drinks per day. I believe that this is an important conclusion because we now know if a woman comes to us and asks us, should I drink alcohol, and she's in the childbearing age, we know that this is definitely something that she should avoid. But now we can make, as a physician, I can make recommendations to all people that come to see me that they should avoid alcohol and find some other way to accomplish what they think alcohol is doing for them. So this paper made clear, abundantly clear, that we should not drink alcohol because it's so damaging to our health.